Okay, our next speaker is Dr. Jane Orient, and she is the Executive Director for the Association of American Physicians, and this organization, once again, is one of the sponsors for the National Doctor Tea Party. Dr. Orient's focus is to support the traditional values of medical practice, and she was in the past instrumental in defeating Hillary Care, and now she guides us again to work similarly in defeating ObamaCare. Big welcome for Dr. Jane Orient.
Thank you so much for coming out to our tea party. I want to tell you a little bit about AAPS, because it's a group that defends private medicine. And I want to tell you what that is, because there's a little bit of confusion about it. You say private and people think about limousines and fat cat doctors and high-rent districts and outrageous fees. Private medicine is not the same thing as private practice. A lot of doctors who are in private practice do corporate medicine. Private medicine is about the relationship between one doctor and one patient. And one of my mentors in AAPS has been explaining the difference between, since about 1940, gives an example of a friend of his who had a gallbladder surgery recently, and his friend told him he had no idea the name of the anesthesiologist who actually suspended his life during the surgery. Didn't meet the doctor before or after, won't get a bill from him, and won't pay him directly. Well, Dr. Kane has done it differently. He has practiced private medicine and anesthesiology for about 50 years. He practiced alone. He said he knew his patients inside and out, and his patients knew him by name, by face, and by touch. That's private medicine. And the ethic is the oath of Hippocrates, where he was serving his patients according to their good, not the good of the bottom line, and according to his own best judgment, not that of Donald Berwick or the other 159 bureaucracies. But you know, this is not really even in style today, even before Obamacare. To get medical staff privileges renewed at my hospital, I had to sit through this video, even though I'm an internist, about the timeout in the operating room. And I think it's pretty good to have a pre-flight checklist and so on. But looking at this, I thought, it's possible that neither that surgeon nor that anesthesiologist has ever laid eyes on that patient before. And to them, he is a body with a wristband on him that's barcoded, and everything about his medical story that's accessible to them is in the electronic medical record that was input by some clerk or other, we hope accurately, and we hope it ended up in the right record. But this independent doctor is the enemy now. And Donald Berwick, our new director of CMS, wrote about it back in 1996. The independent doctor, he's responsible for all of the increasing costs. And what we need is a system modeled on the Japanese car industry. We need to have an assembly line where we standardize the behavior of all of these healthcare providers. And that's his ideal. This is a drastic change in medicine and also in American culture. American culture is based on the respect for individual rights, for free enterprise, and for self-reliance. Your health is your responsibility. The person who's responsible for providing for you and for your family is you. It's based on the precept that every man must carry his own burden. That comes back a long way. You've probably heard everybody has to carry his own load, and perhaps you don't know where it comes from. It comes from the letter of St. Paul to the Galatians, chapter 6. And in the same chapter, it talks about how we need to bear one another's burdens. Well, gee, how could that be? We help each other out willingly, and it must be willingly because, as St. Paul said, we are called to liberty. And we help fellow man out of love. And 5 centuries before this Greek Testament, the New Testament, there was a Greek physician named Hippocrates. And Hippocrates says, well, why do we practice medicine? We do it for love the love of the art, and for the love of humanity. Well, there's no more of that. We know that some people have a heavier load to carry than others, and often it's really not their own fault. And what we need is to make life fair by coercively redistributing everything. We take all the resources and put it into one big pot, and then the gurus at the Department of HHS decide what each of us should be allowed to have. And, this idea doesn't date back just to 1917 to the Bolshevik Revolution in Russia. It's been tried out here before in Massachusetts, which didn't seem to learn much of anything because it's trying it again. But in Massachusetts, they put everything that could be produced into one storehouse, and you were supposed to take out just what you needed. And guess what? They were starving to death. Because it seems to be a law of human nature that nobody's been able to repeal, that if you don't let people keep the product of their labor, they stop working. And if you don't work, you starve. Well, William Bradford, the governor of Massachusetts, did away with the socialist system and went to a free enterprise system, and ever after that, the community thrived. They tried it in Jamestown, Virginia, too, and what they found out was that in a socialist economy, it takes 30 people to do the work that 3 people can do if they have freedom. Freedom is a very good thing, and we're about to throw it away. And we need to stop that. Now, everything's supposed to be fair and compassionate. Well, forget about the rule of law that every American is supposed to be treated equally. What ObamaCare does is slice and dice people, slice everybody up in 100 different ways in order to decide how much they need to pay in insurance premiums, how much they get in subsidies, how much they're punished for one thing or another, and ultimately how much treatment they're eligible to receive. Some of the things they want to know about. How many people work for that person's employer? Where does he live? Because the Dartmouth Atlas says there's some areas of the country where people are getting too much medical care. So man, if you live in Minnesota or instead of Texas, then maybe you're going to be eligible for less care. And they want to know all about your family, including whether or not some of them are here illegally. So if you're worried about an Arizona cop stopping you for a traffic violation or something, you really ought to worry about the people in ObamaCare that want to know all about these things too. And of course it wants to know your race and your ethnic group and your culture and your religion and your sexual orientation so they can figure out whether you're the member of a health disparity population, in which case you'll get more of certain things. So forget about all of us being individuals who deserve to be treated equally under the law. Some of us get to contribute more, some of us have more taken from us, and some of us get more from the government. Well, the Japanese, of course, are very good at assembly lines and they make very good cars, but they also have 3 excellent 4-letter words that I think apply to ObamaCare. Muda, which means wasteful and non-productive labor. Mura, which means something that is uneven and inconsistent. And Murray, which means overburdensome, unreasonable, and absurd. If you start reading this 906-page bill, you'll find it just chock full of Muda, Mura, and Murray, and I think you could easily think of an English synonym that will summarize it very nicely. But no matter, they say, no matter how bad it is, we're past that all, we're into the implementation stage. I hear that at the AMA meeting, there may have been some outrage in Houston about the AMA selling us all out and us endorsing the plan. Well, in Chicago in June, everything was very passive. Well, they won, and so now it's just up to us to implement it. I say no way. What we need to do is we need to repeal it. Just repeal it. And if you think the president's going to veto the repeal, we need to defund it. The House of Representatives is responsible for every dime that is spent. And we need to enjoin it. And AAPS has gone to court, along with some other people, asking the court to do exactly that, to enjoin the individual mandate, forcing you to buy insurance that's overpriced and that you don't want. We also need to nullify it. We applaud Missouri for passing a law to do that. We applaud Virginia. We applaud Arizona that has it on the ballot this far. States need to nullify that, but then so do you. So do physicians and patients. Don't enroll. Don't cooperate with it. It'll cost you revenue. It'll cost you a fine, perhaps. But can it cost you more than becoming dependent on a bankrupt for your livelihood or for your medical care? Liberty is something of which it is easily said you either use it or lose it. We need to exercise our liberty because with respect to our medical care, it's not only our liberty that's at stake, it's our very lives and the lives of the people that we love.